Hello, welcome to Smile with Medicine. Today we will be looking at aspects of a true life story. Jojo was a very active, fun-loving and brilliant woman who began to have pain in a part of her body. At first it was mild and not distressing, so she paid it no heed. Then it became very painful and restricted her activities. She also began to feel sick, so she went to the hospital and had to be admitted. Several tests were done, including x-rays. Days later, the doctors came to her room and dropped the bomb. Jojo had advanced cancer and had only 3 months to live. It was as though a thunderbolt had suddenly struck her as she staggered for support and struggled to breathe. She could not utter a single word. She was totally devastated and refused to eat or drink anything anymore. She also forbade the doctors from contacting or sharing the information with anyone. She just wanted to be left alone to die. For her, it was a death sentence. What should patients do to help themselves in such difficult situations, and what is to blame for Jojo's accelerated death? These were the questions someone asked Smile with Medicine. To start with, it is very important to remember that in life there is never a single way to do things, never a single option. Moreover, sometimes these medical predictions do not come to pass as they said it will. There could be a tiny window of possibility even with such terminal predictions. Indeed, some cancers have been known to vanish without treatment, a phenomenon called spontaneous remission. So when she received the terrible news, Jojo should have taken charge of her health rather than drown with the sinking ship. Our health is the most important thing in our life, and it is certainly our most important responsibility. The doctor is a helper, but the patient makes the decisions. And their responsibility includes screening early for cancers and other diseases, as well as all the decisions they make thereafter. Again, how well the prediction comes to pass also depends on the individual patient, their will to survive, their subsequent choices of food and other treatment options, their mood and disposition to the disease, and every other decision they make thereafter. Indeed, several cancer patients have tried other treatment options to cure the cancers when faced with the death sentence, unquote. And sometimes the results are very different from the doctor's terminal predictions. Besides, what is there to lose when the first option can no longer offer you any more help? One must fight to conquer the disease. To give up and die quickly is not the option, especially when we remember that every day of one's life is meant to be a gift to the world, to make the world a little better. And this strong drive to give and to live is a vital part of the treatment of cancers. Thus, we should make use of every resource available to us and not only a single option. Because where one option is deficient, the other option may make up for it, as is the case with the different classes of food. In summary, life is very rich, and we are supposed to be beneficiaries of this richness. We should not make ourselves paupers in the midst of such wealth, or starve in the midst of plenty. Life does not give us only a single option. Thank you for joining us on Smile with Medicine. We welcome questions, stories, and other helpful contributions, as our goal is to make the world a little better. Kindly like, share, and subscribe to our videos.